stop for a second, because you have not been taught this. You've been taught how to give meds and how to assess your patients, but you haven't been taught how to chart legally and safely. And this is what we're talking about when we're talking about how to document within your scope of practice. An important key to figure out is that what is common on your floor may not be legal and safe. I say that again. What's the common practice on your floor may not actually be legal. So what do you mean by this, Tanya? For example, what if an LPN who has about 20 years of experience is allowed on her floor, his or her floor, to complete initial assessments of a patient being admitted to that said long-term care facility, right? That is not within the scope of an LPN, but it may be delegated to them by the supervising RN, or it might be delegated to them by the RN that they're working with on that shift, but that does not make it legal. And if something were to happen, that would be outside the scope for that LPN who completed that said head-to-toe initial assessment. In fact, the LPN as well as the RN may face legal ramifications in case anything happened to the patient that harmed the patient. It may actually be classified as malpractice on behalf of the nurse or the LPN who provided that particular assessment, or who did an intervention that was outside of the scope of practice. So we have to be aware of that, guys. It's not only following the trend, we have to do what is right and what's legal and documenting accordingly. Like and follow if you want more content like this, and go ahead to grab my guide, which is linked below. I'll see you later.